Okay, we're going to talk about cataracts, folks. We're going to talk about everything cataracts, glaucoma, eye injury, stress and pressure and eye strain, etc., etc. Things related to your lids, eyelids, palpebrian muscles, ptosis of the eye, etc., etc. And what I wanted to say was, frequently people are taught to believe it is age-related. It's age-related, that it's inevitable because your family had it and your mom and dad and grandparents had it, you're gonna get it too. Europeans get it more than tropical people. There's all sorts of stuff floating around, and that nothing is further from the truth than that. A lot is dependent upon how you take care of your eyes. And in taking care of your eyes, the most important to understand is how your eyes work. And we're going to talk about how your eyes work. If you have questions, raise your hands and we will take it from there. Did you see this picture earlier or did you not see this picture earlier?
See it now.
Okay, you're seeing it now. This is a beautiful picture of a 103-year-old lady who can see perfectly fine. Our eyes are meant to last us all our living lives. They're the window of our souls, and she has the most beautiful expression. Maybe she sees a little fuzzy, but she can see just fine. And so it's very possible to have very good ocular health if you understood to look behind all those terms and see what was actually going on. So here is, I'm trying to get rid of this thing at the top, but I can't. Okay. So here is this eye, a picture of the eye. Now, can you see my cursor moving around?
Yes.
Yeah.
Excellent. Okay. This is your eyeball. Everybody, if you could put a hand on your left eyeball just to feel where it's at, you will see you have this eyeball in your eye socket, and it's got a very thick layer of connective tissue on the outside, but on the inside, it's a beautiful thing of nature. It's a complex, marvelous, insanely wonderful organ that just works on its own for decades and decades and decades. So on the outside is the sclera. The white stuff on the outside of your eyeball is sclera. You have a hole in here through which there is a bunch of nerve fibers that go out into your eye through a central sort of artery. There are veins and arteries that surround your eye to nourish and feed it. And when light falls on this cornea here, you have this lens here that looks exactly like the white of raw egg white. And that's a biological lens. Light goes through that, through this liquid, which is also crystalline transparent. It's very transparent liquid called aqueous humor. And it goes and falls on your retina. And that is where your central vision is located, in this spot called the fovea, which is on top of a little round spot called the macula. So this is where your central vision is located. When you're looking at my face, this is where you're focusing. This is where you're seeing my face. And for people with macular degeneration, instead of my face, you're seeing a blur. For people with glaucoma, frequently you can see my face, but you're seeing a tunnel around my face. And we'll talk about the differences there. Your eye is fed by your blood vessels, your veins and your arteries. And guess what happens if you hit that eyeball with a hammer or if you get into a car accident? Anyone take a guess what might happen?
Things break, things get lost, things flow out, all sorts of things happen internally.
Yeah, all sorts of terrible things can happen. The lens can get damaged, break. The cornea can get damaged and get torn. The iris can get damaged. Your lens can get damaged. Your eye can get pushed in, and there can be enormous pressure here, which can damage your fragile optic nerve. Once your optic nerves get damaged, guess what happens?
You lose your sight.
Yeah, you lose your sight because no signals can travel to the brain. No counter signals are going to come back and tell you what that image was. And so a lot of people lose their eyes in eye accidents on account of very high pressure created here from the wham of something hitting your eyeball, which is why the bones in your skull really protect your eye. And nature has just made a marvelous, marvelous organ here. So anyhow, that's the optic nerve. There's the veins and arteries going in from here as well. And the veins and arteries surround the sclera, the outside of your eye. And what is inside the eye is not blood, because if you had blood, you wouldn't see it. It's opaque. What's inside your eye is a liquid on the right side of your lens, between the lens and the retina, called the vitreous humor, and another kind of liquid called the aqueous humor, which nourishes your eye. So it's like the serum. It's like the serum from your blood vessels comes in, nourishes your eye, gives you everything your eye needs, and then the stuff filled with the extraneous matter, the proteins, the gunk, the viruses, the bacteria, the schmutz, goes out through various canals over here called the trabecular mesh, where they're drained out and back into your circulatory system, picked back up again, and then sent into your excretory organs. So it's an amazing, amazing invention of nature, of God, how this whole contraption works. If any damage is done to the optic nerve, God forbid you get in a car accident or you get punctured with a nail in your eye, your optic nerve can get damaged. Your vessels, blood vessels can get damaged. And when that happens, it's an emergency. You gotta go to a hospital and get that fixed. For emergencies, hospitals are wonderful. What hospitals are not wonderful for is long-term chronic degenerative cataracts, glaucoma, macular degeneration, etc. What hospitals and doctors are not good for is curing these conditions or healing these conditions. But if you have an accident and your lens is broken, a surgeon can do marvelous and miraculous things with your eye. Putting in a lens, a new corneal transplant, sometimes even a new eyeball, you know. So understand what's good for your eye, what is good for your eye health. And then what happens is various factors. It could be drugs, it could be insulin resistance, it could be anything. The aqueous humor does not flow back through these channels. The circulation happens like this. See my arrow moving? The aqueous humor is created by ciliary bodies that reside at the edge of your lens here. And the fluid is created and it goes in through this chamber and in between your cornea and your iris. And it is nourishing this whole area. And once this is done, it flows out through the trabecular meshwork at the end. If for some reason, these things get blocked up or gummed up or scarred, or you have an accident, or the capillary mesh here gets messed up, this fluid is not able to move around. You either have too much fluid or not enough fluid being generated, like Fuchs dystrophy, when there is too much or too little and all sorts of things happen. Then pressure may be created over here if it cannot drain properly. When pressure is created, this lens gets pushed, and that puts pressure on the eyeball here, the vitreous humor here. And when that puts pressure on your optic nerve, it gets damaged. It's a very, very delicate nerve, and you need pressure of about 10 to 21 millimeters of mercury here in order for the optic nerve to not be damaged. And that's what ocular pressure is. So what your surgeon or your ophthalmologist is going to do is he's going to put a little thing here on top of your cornea, and he's going to measure the tone of the cornea. And if it springs back, if it pushes back at him a lot, he's going to know that you have pressure here. And if you have pressure here, he will diagnose glaucoma. If you don't have pressure, you might still have glaucoma. There are many people, we spoke, one of you said you have normal pressure and yet you have glaucoma. And we'll go into the reasons why your optic nerve still got damaged despite normal pressure. But the key here, guys, is to remove the problems here in the trabecular mesh to make it so that your fluid can flow back and forth easily. And so when injury happens, when your eyes get inflamed, it's a sign that your trabecular mesh may not be working that well. And that's when you take action, because you can go for many years getting blinder and blinder and blinder and not even knowing you have glaucoma until it's too late. But there are some early signs. You have eye strain, you have eye pressure, you don't feel good, your eyes feel too dry or they feel too wet. There's too much or too little fluid coming out of here. And you can address all that primarily with diet, and very addressable with diet. The other thing that can happen is your lens. Your lens can get clouded. And what is the clouding of the lens called? Take a guess.
Cataract.
Yeah. Cataracts can be in the front of the lens. Up the picture. Yeah, they can be in the front of the lens here. They can be on the back of the lens. And when they're in the back of the lens, they're called subcapsular cataracts. If they're in the center of the lens, they're called cortical cataracts. If they're on the edges along the perimeter, some people along the perimeter have little spikes of lens clouding happening, and that's called cortical cataracts. These names are important because they inform you as to the reasons why you might have gotten the cataract. So it's very important to ask your ophthalmologist or optometrist, hey, what kind of cataract do I have? What is my pressure, my ocular pressure? If I don't have ocular pressure and I still have glaucoma, why? You gotta ask your doctor why. So the ocular pressure here is gonna cause glaucoma, which is gonna destroy your optic nerve. If there is an impurity or clouding in your lens, you can have lens damage, and that's a cataract. And then there's this thing called a macula here. It's a little disc just north of your optic nerve over here. And it has a little indentation called a fovea. And this area is very rich in the cones, the rods and cones, in cells that are responsible for your central vision. And sometimes this thing, which has little hair sticking out of it, the macula of the rods and cones, underneath that membrane, just like a rug, like a carpet collecting bad stuff, an unvacuumed carpet, it gets thickened with something called drusen, yellow stuff called drusen. And a lot of that is because of insulin resistance or diabetes that is undiagnosed. And we'll talk about that as well. But this here is called macular degeneration. This is called macular degeneration. If this membrane degenerates, and what happens? Can anyone guess what happens with macular degeneration?
Yeah, you lose your interior and still have your peripheral side.
Exactly. You lose your central vision, and I'll put up a graphic for you all to take a look at yourselves. Close one eye first and then another eye. But that is a critical part of your eye. The vitreous humor is a very critical part of the eye. The liquid needs to be preserved in its pristine state. The lens needs to be preserved in its lens or lens state. And you need to keep your cornea protected so that it does its work. The other thing that can fail is your muscles, your ciliary bodies, your muscles here. You know, when people get vaccinated, frequently you get Bell's palsy, like that. And so with one eye closed, you can't see. You not only can't see, but some of your muscles here that operate, the ciliary bodies might get impaired and affected. And all of a sudden, not only is your lid down or lid up, and you can't open your eyes wide enough, but now your fluid is not clearing well. And so watch out for things like that. The optic nerve is heavily and severely damaged by the aluminum and mercury in vaccines. I cannot tell you how many children I have seen who got their first 15 or 20 shots, and if you can see my face, they got strabismus, or one eye out and one eye cross-eyed. They got cockeyed. And that's because the muscles get damaged, the optic nerve got damaged, and the muscles are not able to move the eyeball to the right and to the left at the direction of your brain. Any questions so far?
Keep going.
Okay, no questions. So we've talked a little bit about macular degeneration, which is located here. We've talked about glaucoma, which is essentially the destruction of the optic nerve for various reasons, whether it's from high pressure, pushing out here, this fluid not moving properly, this fluid not moving properly, or from the optic nerve not being nourished by your blood vessels. What happens when the optic nerve does not get nourished by your arteries and the gunk taken out by your veins is it dies, it atrophies. When it atrophies, it doesn't work. And that is frequently caused by too much sugar in your bloodstream, unbeknownst to you.
There you go.
All right. So what are the symptoms of glaucoma? Many of you have glaucoma. Can people talk a little bit to the symptoms other than what I've mentioned here? What symptoms do you experience from glaucoma?
Well, Ralph here. I don't experience any aches or pains in my eyes. I just experience less vision. It's things are fuzzy and cloudy and foggy, and it just gets worse every day until you can't see at all. But I luckily don't have any aches or pains, just lack of vision.
Okay. Anyone else want to say anything about their glaucoma?
I'm not certain. This is Land. Am I unmuted here? Yeah. I'm not certain if it has to do with glaucoma or not, but when I had cataract surgery on my left eye some years ago, it was deduced after a while when my vision didn't seem to improve that I had optic nerve damage. I don't know if that was because of the surgery or because of the state of glaucoma, but my current ophthalmologist has said that the pressure was increased when the surgery took place, which could mean that my eye was not sensitive. It was too sensitive to an increased pressure, and that's what caused the optic nerve damage. I don't know the truth of that, but the only words I've ever heard about that. So I don't know the relationship between the surgery, the glaucoma, and the optic nerve damage.
Yes, yes. Very possible that damage occurred during surgery. I've seen, Lord knows I've seen enough people blinded by surgery, but surgery is also amazing if done right in that it can restore vision, especially if you do cataract surgery, etc. But yes, a lot of that stuff can, and if it happened right after surgery, chances are it was something that occurred that damaged it. And that something might not be surgery. It could be the drugs post-surgery. It could be steroids. It could be antibiotics, because we'll talk about the side effects of all those things. So when you mess with the eyes, guys, be careful, be careful. Glaucoma is essentially damage to the optic nerve. It can be, there's different types of glaucoma. One is the open angle glaucoma, one is the closed angle glaucoma. And the open angle glaucoma is, if you can see my cursor, the fluid is flowing this way, it's going through the trabecular mesh, and the mesh gets gummed up for whatever reason. It just doesn't work. The arteries and veins here, the networks are not picking up the junk. There might be scar tissue, etc. And that is what causes open angle glaucoma, the pressure over here. There's another kind of glaucoma called closed angle glaucoma. And that is if you get an infection here and all of a sudden this aqueous humor cannot drain at all. You get sudden eye pain and it's an emergency. That's when you got to rush to the doctor. They can put a shunt in here to release the pressure. If you don't do it fast, you are going to be blinded forever, because that can cause a lot of damage to your optic nerve, which is very fragile, very, very fragile. So that's it. Yeah. So anyone had a question? No question. Closed angle glaucoma therefore requires it to be considered an emergency. And then there's normal tension glaucoma, where you had perfectly normal ocular tension, and yet you have glaucoma, high pressure, or destruction of your optic nerve, and that is very likely from insulin resistance. And that's the elephant in the room that nobody talks about, but we will talk about that. The effect of poisons, the effect of blood sugar, the effect of glycation and oxidation on your precious eye. Okay, the next thing here is macular degeneration. And what you see here, if you can see this picture of the eye, is that's the macula. This is the optic nerve, which has the basket here of nerves and veins and arteries that go through your eye, all around your eye. The optic nerves goes through the eye, and it takes signals that are transmitted from the outside world into your brain and then translated back for you. Then we get to the macula, which is this cup-like or a disc-like structure here. And what's happening in the macula is, you see this? There are rods and cones here. Then you have epithelial, retinal epithelium over here, and you have blood vessels underneath. And what's happening is stuff, schmutz, is collecting under the epithelium. And that is called drusen. It's like dry yellow matter that collects, and that is purely dietary. Once this scar tissue happens, you might get too many a network of arteries and veins here. And you've seen those people with bloody eyes. They go out to run, they get bloody eyes. Hot day, they get bloody eyes. That is wet macular degeneration, where there's an over proliferation of blood vessels. The very fragile rods and cones get destroyed, and you literally have clots of blood here. Or it might be that these things get closed off and you have ischemia or ischemic strokes, or blood circulation stops and your rods and cones can no longer be nourished and nurtured, and you go blind. So you have a normal macula with the blood circulating freely, the nerve ending circulating freely, the rods and cones are being nourished, and then you get this drusen here, which is your dry macular degeneration. And you can also get wet, which is big red marks or strokes or retinal retinopathies that can destroy the macula here and mess up your central vision. See the central vision? It is the vision that allows you to look at my face and see my nose. And that is macular degeneration. So the point I wanted to make was, we have glaucoma, we've got cataracts, we've got macular degeneration. These are all names. They also have Latin names to describe the phenomenon, which has underlying it very specific principles of diet, nutrition, and health. Everything that cures a cataract is gonna cure your glaucoma, or heal, I shouldn't say cure. Heal your glaucoma, heal your cataracts, heal your macular degeneration. And that's what we'll talk about today. This is a very nice picture of dry macular degeneration and wet subretinal hemorrhage of the macular degeneration. So see, this is dry where there's atrophy, so nothing can get to these rods and cones, and there's drusen underneath the epithelium here. Whereas over here, you've got hemorrhages. So all these arteries are broken, there's bleeding, there's clots, and traditional or mainstream medicine believes, and they're right, that it's caused by something called vascular endothelial growth factor. Now, why does your body produce VEG? It produces vascular endothelial growth factor in response to high insulin levels. Why does it produce high insulin levels? It produces those in response to high amounts of sugar in your diet, high amounts of carbohydrates that your body is not able to efficiently convert into other energy, into either energy or fats or what have you. And so what we're doing today is we're saying, oh, gee, that's caused by a growth factor in your veins and arteries called the vascular endothelial growth factor, which is stimulated by your body, and it causes this much as you have arteriosclerosis, atherosclerosis, which is plaque to occur in your arteries, this is like atherosclerosis of your eye. And so there's this growth factor that causes overstimulation of your arteries and veins, or damage which causes your body to lay down a Band-Aid. This is like a Band-Aid that the body laid down. And it's actually an adaptive mechanism, because if your body did not do this, guess what would happen?
Go blind.
You'd go blind. You would have real wounds over there.
Mhm.
So it is the vascular endothelial factors, and as point of fact, your body's adaptive mechanism. But what are we doing? We're giving people injections of anti-vascular endothelial growth factor. This is anti-VEGF, it's called. And what that's going to do is temporarily, it's going to reduce the VEG, but it's going to make you blinder because the underlying condition never got addressed.
Mhm.
Sushama, does that relate at all to when my doctor or someone calls and says I have dry eye, and says the solution, so-called, is to use these drops which lubricate?
Right. So yes, so the lubricating drops are not getting here. They can. I mean, you can inject anything into the eye space, but the lubricating drops are on top of your cornea. They're frequently steroids. And what steroids are doing is they're suppressing the inflammation. They're suppressing the prostaglandins. But at the same time, by doing that, they're damaging your eye. And we'll go through what the steroids are doing as well. And dry eyes are caused by fluid not coming into your cornea from the outside of your cornea. So let me go through that fluid. So this is your cornea, right? And your glands in your eyelids release fluids that's keeping your cornea wet and nicely hydrated. There are ciliary bodies here that are producing this aqueous humor that is keeping this area lubricated, and your vitreous humor is formed in the inside. So what you're talking about is eye drops over here that respond to, that are used in lieu of the oil glands here, not releasing corneal fluid to hydrate your eyeball.
So among the possibilities, it could be a trabecular mesh is not eliminating the things there, which is causing a dryness or related to dryness?
No, it's probably the oil on the outside between your eyelids and your cornea that's causing the dryness. The trabecular mesh not draining the aqueous humor properly is going to result in a glaucoma.
Got it.
And that's just blindness. So you're not going to experience dry eyes necessarily, but they are an indication that something is not right with your eye. Your Meibomian glands, these are glands in your eyes here on the side, that they might not be working. And a lot of that is diet. I want to relate an experience where I came back from Malaysia and on a very bad, I was eating out every day with very bad oils. And I came back and experienced very dry eyes. I was just premenopausal. And as soon as I changed my diet to a high fat diet, my dry eyes totally disappeared. So one molecule of fat in your body is going to make 10 molecules of water. And the best way to hydrate yourself is to eat lots of fats.
Great.
So my recipe for dry eyes on your cornea is tons of butter or ghee or lard or tallow and what have you.
Great. Thank you.
All righty. And so this is macular degeneration. We talked about three things. One is cataracts, one is glaucoma, one is macular degeneration, and the fourth thing, which is dry eyes, which a lot of people, especially people with autoimmunity, seem to have dry eyes where the glands don't work as well, or people who have paralysis of their muscles where the bodies that squeeze oils into your eyes don't work, or people with MS, or people who were damaged by drugs or poisons or mercury or aluminum in vaccines. Frequently, that's how it starts. You get dry eyes. You may have less aqueous humor because your ciliary bodies may not be working. and that leads to damage to your eyes. So in my view, the vascular endothelial growth factor is an adaptive mechanism. It is the policeman that is trying to get your eyes to stabilize and not go blind. And so what you don't want to do is apply things topically to change the symptoms. It's like if your fire alarm is going off, you break the fire alarm instead of fixing the source of the fire. And so what you want to do is try and fix the source or the leak. This is another very nice picture, eye stroke, where you have literally veins and arteries that get blocked. So if your arteries are blocked, you can have occlusion, which is no blood supply to that part of your retina. And if it has no blood supply, it has no aqueous humor, it has no vitreous humor, and you pretty soon lose your sight. Or you can have clots. There may be leaks or hemorrhage in your blood vessels, in which case you get clots or eye strokes where you can go blind just as well. Now, if you could please all raise one hand and look at the spot in the center of this PowerPoint and see what you see. Can everybody see that dot in the center?
Yes.
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 Okay, now close your other eye and see how it looks.
Very, very wavy and no spot at all.
That is macular degeneration.
Yes, that's dry eye. And my concern is that it doesn't go into wet. And it went so bad in just a matter of 2 or 3 months. It went from, my sight was 20/30 to 20/80. And so that's when the ophthalmologist sent me to the retinal doctor. But now it's 125. So.
Okay, so tell us about it. What happened in those 2-3 months? What was the
You know,
period?
but just one eye, Sushama. My other eye, thank God, is good. It's straight. So for that, yes, I'm looking back now, and I think it's about 3 years ago when I was really suffering with the effects of the celiac,
Yes.
and it couldn't eat, and I think that's probably when it happened. So it's very distressing. I have good peripheral vision, so I can still drive, thank God, but it's getting harder and harder to read and write.
Okay, all right. Thank you for that. Anyone else have any comments on that? Looking at it?
I do too, and I have a question which is related to me personally, but it relates to the being able to see peripherally. After my cataract surgery on my one eye, where an artificial lens, of course, was inserted after the old lens or my natural lens was removed, the doctors thought that I had a transient stroke. And so I went to UC and they did all kinds of tests and MRIs and all that kind of stuff. They couldn't see anything. And their explanation was that the stroke had happened, had passed through or something like that. And there's no longer any evidence of that. So I don't know if that was doctor speak or something else. And they were telling me the truth that they didn't really know if that affected my retina and my inability to see further.
Absolutely. Look at this, eye stroke. If there's occlusion or if there's clots, even temporarily, it's going to impair vision if it carries on. Or you're just not getting nutrients to that spot in your retina or to your macula or wherever it happens to have clotted or wherever it happens to have occluded, if there's an ischemic venous occlusion. And the sooner you deal with that, the better. The faster you treat that, the better. And here, I'm going to make a plug for arnica. Anyone with any kind of eye bleeding, eye problem, retinopathies. The problem here is you don't know it until you suddenly lose vision, see? But if you suspect, but your body will give you small clues. And if your ophthalmologist tells you you're bleeding or there's occlusion. There's no better homeopathic remedy than arnica to address these congestions.
Can the occurrence of the supposed or the supposed ischemia, the stroke, could that be detected, or is it, as they say, you can't tell after the fact?
You would have to do these kinds of scans where you literally put a dye through your arteries and veins, light them up, or through various scopes, you can see these, and they will find out areas where either the blood flow is occluded or there's a clot, and then treated. What you could do is get pictures taken. This is a picture. This is just a scope, and you will know. And once you have that picture, you'll be able to treat it with diet, with homeopathics, with exercises, etc.
Okay.
But if it's been too long, if the surrounding tissue is dyed, less easy.
Right. Understood.
All righty. Any other questions on this? All right. I kind of wanted to give a visual, see that albumin. I tried to show it to you. Can you see my egg white here?
Yes.
Yes.
Oh, yeah.
Okay, that's what it's like. That's what it's like when things are good. And that is what it's like when it gets glycated. And folks, one of the earliest complications of diabetes is eye damage. Unbeknownst to a person, unchecked, the optic nerve gets damaged, there's retinopathies, the veins and arteries going to and fro get damaged, and before you know it, the lens thickens and becomes opaque. When that happens, you can't turn it around. So you want to get it, well, stuff is still half-baked, and your body can actually, is very plastic, and it can help heal it. It can help heal it. But this is one of the earliest complications, and that's the problem that I have with how we diagnose insulin resistance and diabetes. And that is the reason we have an epidemic of strokes, heart disease, kidney disease, eye disease in the country, because we're diagnosing the diabetes way too late, and we're taking actions and steps way too late. And I'll go through Dr. Joseph Kraft's research on that.
Sushama, I want to just briefly interrupt this on a personal level. You talked about the thickness of the cataract, and at a certain point you say it can't be reversed. Is that with everything you know? I've done some, as I wrote to you separately, some other research that says there are some possibilities of dissolving or erasing
Absolutely.
or eliminating.
Absolutely.
Will you discuss that, or will you cover that?
Yes, absolutely. So
Right.
This is a very extreme case where the entire protein is rendered opaque. When you have a lens that is clouded, when you have, say, opacities, when you have little plugs of stuff here and there, your body has the ability to turn back the clock. If you have a neuropathy, in your optic nerve, and you go to a relatively low carb diet, like a 6-6-12 or 6-12-12, 6 carb grams in the morning, 6 in the evening, 12 at night, you are suddenly restricting glycosylation of the lens. You're suddenly restricting oxidative damage to your optic nerve and to your blood vessels. And to the extent the nutrients are able to flow to your lens, into your aqueous humor or your vitreous humor, there is great possibility of reducing or the progression or halting the progression of disease. So absolutely, absolutely.
Is it possible to reverse it though?
If it is too far gone, it's like kidney disease, right? It's stage 1, 2, 3, 4, 5. You can reverse it completely in stage 1, very completely in stage 2, 3, and 4 and 5. It depends on the amount of damage. If the amount of damage is enormous, it's harder to reverse. It's harder to reverse if there's occlusion, say, if there's arterial occlusion, for instance, and that part of the retina or that part of your eye has not received nutrition in 6 months. What are the chances? It's like a plant. What are the chances it'll come back to life? You water it. There may be some element of the root that'll grow back. But if it is early days, if it is Still not fully baked. There's hope, there's chances, and as a matter of fact, diet plays the most important role in this. I've seen a lot of progression of eye disease just grind to a halt on a high-fat, low-carbohydrate diet.
Great, thank you.
All right, everyone tried looking at this spot in the center?
Yes.
Okay. Now we want to talk about what it looks like in the eye. So see that little thing in the center, the sort of opaque, the white egg white region here. That's a nuclear cataract. This is a cortical cataract. You get these spikes from the outside of the lens in, and that's a different kind of cataract formation. Now this is another kind of cataract. So if this is the lens, then at the back of the lens, stuff collects, whether it's proteins that have precipitated out, whether it's sugar that's precipitated out. And I'll show you some unique research done that's kind of interesting, that goes to show you what can happen, and actually, to your point, Len, reverse itself with the right diet.
Mm-hmm.
There's something called Fuchs Dystrophy that, is Renee on the call? Renee, you on the call? No Renee on the call. This was for her. Okay. Fuchs endothelial corneal dystrophy is when your cornea gets damaged. See, this is your cornea, and it's a thin layer of just wonderful and fragile membrane. And when underneath the surface of this cornea, you get excrescences or nubs. You get thickening, you get blisters, you get vesicles. You could get it from injury. You could get it from autoimmune disease. It's slowly progressing if it's autoimmune disease. It happens more to women than in men for some reason. I very much believe it's related to the hormones we take, the antibiotics we take, the vaccines we take, which cause destruction of very fragile tissue and lays, metals or proteins or sugars in that layer and destroys it. So if you look at this chart here, this is mid-cornea. This is a picture of the cornea, and there are the excrescences, these are the blisters that are 1200 nanometers thick here. On this side, they're thick, and this is mid-cornea, which is a somewhat normal surface. So you get these bumps on the surface of the cornea, and that could be from dryness of your cornea, being too dry, too wet. So your glands here are not working well. And generally what causes your glands here, the external glands not to work, is your muscles not to squeeze out the fluid properly, or your meshwork of veins and arteries not pushing out, or your glands not pushing out the oils required to lubricate your cornea. And so what they're prescribed is a eye wetting agent if it's too thin, a dry eye drying agent if it's too thick, for night and day. And there are various things that are administered to manage that pain, that dryness, that wetness. But all those are medications that are acting from the outside. They're not really resolving the problem of your glands not working. Much more common in Europeans, much more common in women than in men later in life. And again, extremely dietary.
Sushama, you've mentioned at times that it's some conditions more prominent in certain groups or certain countries. Is there any research that you know of that identifies what that is? If it has to do with, the amount of ozone in the air, or the diet that's eaten, or too much liver, or not enough liver, or et cetera, et cetera.
So what I do know is, historically, in the ancient times, people on good diets, whether they lived on the equator or whether they lived in the Antarctic, Eskimos did not wear dark glasses. The UV lights reflected off the snow, hit their eyes, and they survived just fine. A lot is in the diet. They ate massive amounts of seal oil, blubber in winter especially, which has high amounts of vitamin A. They ate massive amounts of cod liver oil, or cod, or they would take these cods and ferment them, rot them in little holes in the ground, and they would eat them as nutrient dense food. in these times when fat soluble vitamins were missing in their diet, or actually all through the year. So a lot of it is very dependent upon your dietary. On the equator, people made a lot of vitamin D. There's coconut oil, there's fish. In the Swiss Alps or in the Himalayas, where your air is rarer, ozone is much higher, UV rays are much stronger, people have still managed to maintain and preserve their eyes. So why does it happen now? Is it really that the ozone layer is getting depleted, or is it that our nutrient supply is getting depleted? And perhaps the ozone layer is getting depleted, but we have enough available nutrition where you can make up for it, where people simply do not get these kinds of problems early on in life and later in life with the right nourishment.
Thank you.
Yeah, this is a really interesting article that I came across on cataracts. And if you look at this picture, do you see these snowflakes in the middle of the eye?
Yes.
Those are called subcapsular cataracts, meaning behind the lens in the capsule area, there's glycosylation, which is sugar has dumped out, or some particles have precipitated out on the back of the capsule. And this happened in people who had raging diabetes, but had perfectly good vision still. And when their diabetes was controlled with insulin levels, higher insulin levels, they started blurry vision. They started getting blurry vision. And when the insulin treatment was continued, that is to say, after a period of time and all the glucose was mopped up in the blood, the lenses cleared up again. So I ask you this quiz. Why would a diabetic person first not have eye problems, and then when they started control of their diabetes with insulin, they got these subcapsular cataracts, and then after a bit of time, it went away? Any thoughts?
Well, the insulin is administered not through the body, but to the body, which makes a big difference on how the systems of the body work to regulate the insulin.
Excellent. Excellent. Any other ideas on why this might have happened? That's exactly right. That is exactly right. So what happened on day one, these people had super high blood glucose levels, like 555 milligrams per deciliter.
Wow.
Their eyes were still good, so they could see okay. So basically, their eyes had adapted to this condition of extreme amounts of sugar in their body, and they had adapted to protect the lenses. Their hemoglobin A1C was average 14.9. Enough to kill a person, but they were getting there slowly, but their lenses were clear. They did not at that time have diabetic retinopathy, which is why we call it the silent killer. Your blood sugar goes up, damage starts to happen. To the very end, your optic nerves carries on doing the work because it's a cluster of fibers, and then boom, all of a sudden you can't see. But, so these people, their diabetes was controlled on day 2 by switching to insulin. So as you pointed out, their blood sugars went from 555 to kaboom, 214. What happened to the osmotic fluid, the osmotic pressure, the hypertonicity, the hypotonicity of the aqueous humor and the vitreous humor with insulin? It got completely messed up. Glucose literally got precipitated on the back of the lens. The body got shocked, didn't know what to do. And as they continued with the insulin treatment, slowly the lens cleared up again.
When you say insulin treatment, can you be more specific about what that is or what you're talking about?
Yes. So for diabetes, if you have diabetes and your blood sugar is uncontrolled, frequently doctors recommend insulin treatment because your pancreas are not working anymore or making enough insulin to mop up the blood sugar, sequester it, because having more than a teaspoon of sugar in your bloodstream can be very fatal. Your body just doesn't have the ability to hold that kind of sugar without great oxidative stress. And so your blood sugar is going up and up, you're not able to control it. And because your pancreas are not producing the insulin, which is a hormone that helps bind the glucose to cell receptors to suck them into cells so that the glucose will not do damage.
Right.
And so when you go from zero insulin in your pancreas to massive doses of insulin injected into your body, the body goes, ah, all of a sudden. And all the fluids in the body are affected. Your blood sugar, you might suddenly get, heart conditions, arrhythmias, you might get blurry vision, which is why I find that people who suddenly go cold turkey from a high carbohydrate diet to a diet that eats more fats, they get blurry vision. As this exact same thing happens, you get a subcapsular cataract that blurs up your vision because you're not used to burning fat. Your eyes are burning, your retinal vessels, or your eyes are burning glucose to give you the energy for your eye. And all of a sudden you take that away. So in life, just remember, you have an internal garden. You cannot suddenly give yourself antibiotics and have the garden wiped out and not expect consequences. You cannot suddenly start to eat beet kvass and kefir and sauerkraut and not expect to have symptoms when your body starts to replenish the biota, the microbiota. So it's slow. The response is slow. It's like a seesaw. So what you want to do at all times is not follow anyone else's orders, but to understand what's going on and change it slowly and in a committed fashion. I think there's nothing more important than that.
When you say slowly, that's something, I guess, that in an individual, me in this case, would say regulate. Well, although I've been using the protocols that you suggested, it could be that I am taking, because I eat carbohydrates sometimes with the meals that are being provided, and of course those transform into sugar. And I think if I were to drop that, 100%, just cold turkey, so to speak, just eat turkey, that could put a stressor of some sort on my body, which could create some changes that I have to work with over time.
Correct. Yes.
Okay.
If you make sudden changes, your eyes are going to get blurry, your thyroid might be affected, you might get diarrhea. And so at all times, when you morph to a different way of being, please make sure that you check in with your body when you're doing that.
Yeah.
Paul, I think Sunshine wants to say something. Sunshine, you have to unmute yourself, my dear. No, you don't want to say anything? Okay. You'll have to unmute yourself.
Here,
Yes,
I did that. The thing is, I went to my computer and my computer will not let me get sound. So I have my cell phone here with the sound.
Okay.
Okay.
All right. Yeah.
Are you going to talk at all about, and does this, even though it's titled ocular migraine, how does this connect with the eye?
Very good question. Very good question. Blood pressure within the eye. Blood pressure within the eye might cause ocular migraines, little mini strokes, occlusions, retinopathies, and the same diet that would apply to general ocular health would apply to migraines that manifest themselves as ziggy-zaggies or stars bursting, things happening visually in your visual field. But at heart, you have to, it is a problem very likely of insulin resistance.
Okay.
And Margaret, did you have a question or you just raised your hand? Remember, you've raised your hand.
I raised my hand so that I could ask that question.
Okay, okay, but Margaret has raised her hand also. So if anyone has a question, please let me know. Okay, sorry, I'm still not completely familiar with this.
Must be the other Margaret.
Okay, oh, it's probably, there's 2 markers. That's right, that's right. Okay, all is good, all is good. Okay, feel free to mute back, guys. And I know I have pinned myself. Okay, good. So this is a very, very interesting phenomenon that goes to show you when you do sudden things to your body kind of goes into a kerfuffle, and you got to let things settle down and adjust. Risk factors of everyday drugs. The #1 risk factor here is insulin resistance. What it's doing is blood sugars in your bloods that are uncontrolled, or if you don't have enough insulin, your pancreas producing enough insulin, you are, or if you're making too much insulin, and insulin will glycate your arteries and your veins because of a high level of blood sugar. Too little insulin and you have too much blood sugar, which will glycate your arteries and oxidize everything. And too little insulin will cause, well, too little insulin will cause high blood sugar, and too much insulin will cause growth factors to be stimulated in your body. So this VEG, which is a growth factor, is stimulated by too much insulin in your body. So if you're eating fewer carbs, there's less sugar in your body. So the sugar is not going to damage you. If there's less sugar, there's going to be less insulin in your body, and the insulin is not going to damage your body by secreting these growth stimulating factors, such as the VEG, IGF, and so on, which stimulate basically cancers and proliferation of tissue in your body. And I'll walk you through Dr. Joseph Kraft's research. Antidepressants cause cataract formation. We've had an entire generation of children on antidepressants. They're photosensitive, leads to cataract formation. Corticosteroids prescribed a lot for eye problems will cause actually glaucoma. They'll cause destruction of the, or imbalance of the ocular pressure and macular degeneration. Psychiatric drugs like phenothiazines, arrhythmia drug, a lot of heart, beta blockers, blood pressure medications will decrease your blood pressure, which will really destroy your eye and the functioning in your eye. Radiation exposure will cause cataracts in your eyes, beta blockers. Hormone replacement therapies. A lot of women are on the pill, contraceptive pill, causes blood clotting in the eyes. Clotting in the eyes long enough is going to make you blind. Antibiotics will cause retinal detachment, meaning the retina comes off the back of the eyeball. The whole thing detaches with massive doses of antibiotics. Antibiotics are not the solution to life's problems unless you're very, very sick from a very infectious disease. Cholinesterase hemorrhage inhibitors. For Alzheimer's patients, they're giving a lot of these CHIs, and they actually cause hemorrhages in your eye. Antidiuretics, kidney drugs will cause damage. Antihistamines, the stuff you take for hay fever, will cause angle closure glaucoma, which is the angle gets closed, you have this sudden emergency, the pressure goes up, you can go instantaneously blind. So please, if you have hay fever, please use natural means. There are amazing homeopathic remedies for hay fever, allergies, dust mite allergies, pollen allergies, bee stings, and so on. Do not use mainstream antihistamines. And I can say it now because we are our own group. I am so happy. Tetracycline. Women who take tetracycline in pregnancy will cause cataracts in their fetus. My mother did not know anything about antibiotics when she was pregnant with me. I was born with congenital cataracts, so she definitely had some insult to her body that made me be born with cataracts when I was born. Accutane will cause dry eyes. It'll cause night blindness. And so macular degeneration is essentially, an inability. If your rods and cones are dead, or if you can't see very well, you see all these old painters and artists who, Monet, who did things in shades of blue. Chances are they had eye disease, and increasingly they could not tell the difference between black and blue and they made these beautiful paintings based on their then vision. And so there was a lot of blindness amongst painters because they used very toxic paints laden with lead and arsenic and mercury, and they went blind or had cataracts or glaucoma at very high rates. Accutane, the acne medication, will cause night blindness. It'll destroy your macula. Isoretinoin, another acne medication, will cause cataracts. There's a schizophrenia drug, Haldol, an antipsychotic. It will cause angle closure, glaucoma. Aspirins will cause corneal deposits. So many elderly have been taught, indoctrinated to keep eating that aspirin to prevent heart attacks. Well, guess what you're doing? You're bleeding. You're causing corneal deposits and cataracts to occur in your body. Questions?
I have a question. In this slide, you're talking about what I think are called, I'm calling external factors applied to the body, or people take in. For analyzing, understanding something that's happening within the body, I know, or I think I know, that you rely or use blood tests. The blood tests indicate, as far as I know, a level of a substance or a system in the body at a given time. I know also from a little bit of reading that changes. I don't know to what degree, but it does. So if I take a snapshot by having blood tests, and that tells my sugar level, for instance, or A1C or anything else, that means for that day, I'm analyzing, or you're analyzing, if I ask for your help, what's going on at that time. So do you have any words to say about blood tests, which I generally have a reluctance to take because I don't like giving blood for some other reasons, but I want to know if that, among other things, is the major sense that you have of how to test or how to identify levels in the body.
That's an excellent question, and I'm so glad you asked it, because the hemoglobin A1C test is not completely accurate. It measures the sugared up red blood cells, the glycated cells in your body. And if it's 14%, that means 14% of the cells in your body are glycated, or even 6%. You're full-blown diabetic at 14%. But there is this little weird thing, which is if you're on a very low carbohydrate diet, your blood cells, your red blood cells, actually live longer, and more of them get glycated. So it might be a false negative test. And so the best marker of your blood sugar is simply to measure your blood sugar levels now. Take a meal, after the meal, take it, measure it every hour to see where your blood sugar is at. And that will give you the exact manner in which the blood sugar postprandial in your body goes down. And generally in an hour or two, it's got to settle back to normal levels. If it stays up for a long, long time, or if your blood sugar, and the other test is insulin levels. So there's two tests. The blood sugar level you can do by yourself. The insulin level you cannot do yourself. So a lot of hidden diabetes is when your blood sugar levels become normal, but your insulin levels are still high. And insulin is a very damaging hormone in large quantities. It's great for bodybuilders because they're building muscles. If you're not building muscles or growing tall, you don't want to have high levels of insulin. And after a lifetime of just pushing your pancreas, your insulin levels sometimes stay high. And that is what is the cause of the big insulin resistance or chronic degenerative disease that's not diagnosed because they don't test for the insulin levels. They only test for the blood sugar levels. You follow me?
Yeah, the question I have, I saw you point to your wrist. I'm assuming that there's a device without sticking needles or pins into your hand or something that you can measure that oneself.
No, you got to stick yourself, sadly.
Okay. And then the second part of that is the insulin. Does that vary, as you mentioned, the blood sugar level does?
Yes, it varies. It varies by a lot. When you're fasting, your insulin levels are very low. When you're feasting, your insulin levels can get very high. And it's not the high or low levels as much as the normalization of the insulin levels once you're no longer eating. You don't need insulin floating in your bloodstream. And that's what you got to measure. That's a very specific insulin test where they give you some sugar to eat and they measure your insulin 1, 2, 3, 4, 5 hours and later. And the people who have lingering insulin in their bloodstreams are the people who tend to have latent ocular disease.
So it's not just going on a fast or don't eat for a certain number of hours before and going to a blood test agency and say, test my insulin. That would not be fully accurate. Is that correct?
Yes. So you first get your fasting insulin, then you go to the place and you eat a big heavy meal, your normal regular heavy meal, and you measure insulin hour 1, 2, 3, 4, 5. It's an expensive test, but we will walk through what happened when this guy looked at that test.
Okay, thank you.
How do you test for insulin?
You go to your doctor and ask for an insulin assay.
Okay.
Is that Mr. Pessinson?
No, it's Mr. Ralph.
Oh, Mr. Ralph. Hi, Mr. Ralph. All right. So why doesn't the person show up on my screen? I'm doing something wrong. Okay, whatever. I will figure it out eventually. All right. So
Here we go.
there you go.
Ralph.
Yeah.
You want to talk to it?
No.
Okay. Anyone have any other questions?
Yes, I wanted to ask if your doctor will only do a fasting insulin. Is that sufficient or at least valuable to know?
Yes. Very good point. If your doctor is unwilling to do the every hour insulin because it's too expensive, at least get a random, two tests I would recommend, a random insulin test and a fasting one. So go eat your food and go get your insulin tested, and then go hungry after a 12-hour fast and get your insulin tested. That will inform you, and you want that insulin level to be in the 2, 3 range and not 15, 20, 30 range. All right, so these are the drug risk factors. Cocaine will cause renal, recreational drugs, smoking, cocaine, statins are increase your cataracts by 30%. So half of the American male population over 40, or at least 1 in 4, is on statins, and you can look forward to cataracts and severe eye disease because can anyone guess what statins do?
They artificially lower the cholesterol you have in your body.
Yes. Statins will lower the cholesterol in your body. Cholesterol is the major repair mechanism in your body, and we're using that as a proxy for heart disease, when in fact it's the repair substance. It's the repair substance that prevents the person from dying of arteriosclerosis.
When you have drugs here, I noticed that I don't see marijuana. Is that part of a cause of eye?
Yes, very much so. Yeah, marijuana use will cause dry eyes. It'll cause the Meibomian glands to not function well, corneal damage. Yes, absolutely. And the half-life of that is about 60, 70 days. So it's very difficult to get it out of your body. And I've seen a number of people with severe eye problems, really eye pressure problems from marijuana use. Yes. Benzodiazepines will cause eye twitching. Viagra will cause arteritic anterior ischemic optic neuropathy, which is to say no blood flow, so blank spots, no nutrition, you die. And I'm surprised Viagra would cause that because it sends blood rushing to where, but it apparently causes optic neuritis. So there you have it. Anti-glaucoma drugs will affect macular sensitivity. So the drugs themselves will cause great damage to your macula, to your inner retinal chambers. Steroids will cause the same problems. Roundup, pesticides, fertilizers, all these toxins, vaccines, the mercury and aluminum in your eye drops or in your vaccines will cause muscle failure. So the muscles that guide the arteries and veins will not function. Your eyelid muscles, your Meibomian gland the muscles attached to your glands that cause them to squeeze. If those don't work, then your eye gets very increasingly damaged. Mercury also causes hyperinsulinemia, which means it causes your body to make a lot more insulin because the body is under stress. So Antivax flu shots and all these other multi-vial shots which contain mercury, 25 micrograms of mercury per shot as a preservative, are deadly. And you know, I was talking to a number of people over the years, and I would say, so are you vaccinated? And they'll say, oh no, I just take the flu shot once in a while. And when I looked at their actual Kaiser records, they had received like 20 to 40 flu shots, Hib shots, shingle shots, chickenpox shots. Add up all that aluminum and mercury, and you're looking at thousands of micrograms of mercury in aluminum. Of course, you're gonna get sick. Of course, you're gonna have the Parkinsonian, Alzheimer's, and multiple sclerosis type diseases. So I would say, folks, avoid all vaccines. Not only do they have immediate reactions, they're very bad for your extremities in particular. They'll cause retinopathies, neuropathies, hyperinsulinemia in the case of eyes.
I have a question on one of your items. You have eye drops, parentheses, steroids, which actually occurs twice in your list, which is just minor. But does that mean eye drops which contain steroids, or
Yes.
all eye drops contain them, or what does that mean?
That means eye drops that contain steroids. There are anti-inflammatory eye drops that contain steroids, but they're in reality causing much damage. Yeah, I should take the second one off, sorry.
Okay, thank you.
So prednisone is often prescribed for eye inflammation, but it damages your ocular pressure. It does damage to the macula. It's a very damaging substance. Prostaglandins are used if you have eye inflammation, and they in turn suppress ocular pressure. They are very destructive of the tissue. And this is what this amazing researcher who worked for the Veterans Administration, actually Ralph, discovered after many, many, many years of research, looking at the dead bodies of people for whom he had all sorts of insulin and glucose data. So this was a guy that the VA, Veterans Administration, allowed to test for insulin back when they had money and you could do such things. And what he did was he looked at some 15, 20,000 people. I think it was like 16 or 17,000 people, dead bodies of people who had died. He autopsied them. And discovered major organ damage ranging from eye to kidney to atherosclerosis. And it was all related to the amount of insulin that they had hanging in their blood after they were done with a bolus of glucose. I will let that sink in because this is probably the most important slide in this whole presentation.
Could you explain a bit of the graph? I don't fully understand that. I see the three different colored
Yes.
curves, and
Yes.
I see an hourly rate, but I don't know what it really means or what it
Yes,
indicates.
yes, absolutely. So this is the level of insulin in the people's bloodstream, measured over fasting. Then they were given a bolus of glucose. After that, half hour, 1 hour, 2 hours, 3 hours, 4 hours, and 5 hours. So first, the person was fasted overnight, and their insulin levels were measured right here. See that?
Yeah.
So some people had close to 0 insulin levels after they woke up and got a blood test. Some people had insulin levels of 52, very, very high. Then they were given 75 grams of glucose, so massive dose of sugar water, basically sugar water. And then he measured their insulin levels after several hours, hourly. And he found that there was a pattern. There were some people who got the glucose, their insulin levels went up and then went down rapidly, and they were copacetic. After 5 hours, their insulin levels were back to normal, close to 0. There were some people whose insulin levels slowly rose even after the shock was over, kept rising, kept rising, kept rising. These are the pattern 3, and then very gradually tailed off. There were some whose glucose level, insulin levels rose very fast and also tapered off, but much higher than the euinsulinemic or non-diabetics. And there were some whose insulin levels just shot up and never went down. These are the people who had heart attacks, blindness, kidney dysfunction, liver cancer, all sorts of chronic degenerative diseases, all while their blood glucose levels were normal. So what Kraft determined was it's not the blood glucose levels, it's your insulin level that determines chronic degenerative disease, and we're measuring the wrong thing. It's just cheaper. It's like the drunk in the lamplight, right? It's cheaper to measure glucose, so that's what doctors measure. It's not cheap to measure your insulin levels, so we don't. And we use the glucose as a proxy. But if you measured the glucose at this point, all of them would have low glucose, but some of them would have very high insulin levels.
Can you explain to us how A1C, what it measures, and how this might relate to these graphs or these experiences or experiments?
Very good. The A1C is a measure of your glucose. It's not a measure of your insulin level. HB is hemoglobin A1C, which is glycated hemoglobin, which is the sugar that is stuck to your red blood cells. So HbA1c is really essentially measuring your blood sugar levels. It's not measuring your insulin levels. It measures the blood sugar levels in a way that is more long-term. So if you were to just look at your blood glucose level today, right now in the blood, it is whatever it is, whatever, say 80 or 90 milligrams per deciliter. But your hemoglobin A1c is a percentage of your red blood cells which have glucose molecules stuck to them. So it's a different measure for the same measure, which is glucose. So if 5% of your blood cells or your red blood cells are glycated, then your hemoglobin A1c is 5%. If it is 10%, then it's 10%. And so what happens in diabetics or pre-diabetics or people with high insulin levels is their red blood cells die very fast. Normally, they have a lifespan of 120 plus days, but these guys' red blood cells die in 60, 70, 80 days because they just get sugared up. They get caramelized. Think of onions caramelizing in a pan. They get caramelized, so they get pulled out of circulation. So while the A1C is a good measure for people on a very standard diet across the board, it's not a good measure for people that are severe diabetics. It's not a good measure for people who have high insulinemia, hyperinsulinemia, and it's not a good measure for people who are on low carb diets, because on a low carb diet, your red blood cells are going to be alive longer and more of them are going to be sugared up as a result of living longer. But that's not a bad thing. It's a good thing that your red blood cells live longer. So if you have 6% hemoglobin A1c on a low carb diet, then it's a wrong result. It's an incorrect result. And a better test for you is to measure glucose hour after hour to see where your glucose levels are at and to measure insulin.
Okay, great, thank you.
Anyone got questions here?
I have a question about the effect on the eyes of both the sugar and its utilization in the body and how that affects the eyes. What I got from an earlier statement that you made is that it seems like certain conditions the body will tolerate up to a certain point, and then I'm calling it collapses or just suddenly changes. Is that correct?
Correct. And the reason for that is your body is very plastic. So in the optic nerve, for instance, it's not one nerve, it's a bundle of nerves. And like 3/4 of them have to die before you will stop seeing. So there's a huge compensatory mechanism in the body that allows you to see until the very last moment. And then boom. But that also says, to your point, that the body is very plastic. The body knows how to heal itself.
So the body knows, and yet we're taking some external, I'm calling it external, but internal measurements of the condition at a particular time and space. And we get a blood test.
Yes. Yeah.
So that's, I'm guessing that's more an indicator than a kind of a total knowledge of what's actually going on.
Yes, it's an indicator, it's a symptom, it's a measurement, which is extremely important because a lot of these are silent killers. So if your insulin levels are high, you want to know about it so that
Yeah.
you can change your diet. You don't want to be surprised with, you know, kidney cancer when out of the you are running marathons and eating a nice low-fat diet, and out of the blue you've developed cancer. You would like to know before, and this test, which is actually a pretty good test.
Great, thank you.
Any other questions? Does anyone have an issue understanding this?
Except for certain words that you used, which describe certain conditions, which are kind of, I have no idea what they mean, but you explain enough of it to I get a sense of what it is you're talking about.
Okay. Which are the conditions that you don't get the meaning of?
Well, the multisyllabic descriptions of something.
Okay. I will try and be monosyllabic. Okay. There's one multisyllabic thing here, which is insulinemia, and that means low insulin. These are the people who don't have problems. They found in Ecuador, there's this tribe of people who are very, very short. And if you're very, very short, they smoke, they drank, they ate sugar, but because they did not make growth hormone, the insulin did not trigger growth stimulating hormone in them, and they lived to their 80s and 90s and more.
Mm.
So your height has something to do with your growth, and later on in life, you don't want things that cause things to grow, if you see what I'm saying. You don't want the VEG, vascular endothelial growth factor. You don't want the insulin. You don't want to stimulate growth because that turns into cancers.
Right, got it.
All righty, so I should say Dr. Joseph Kraft, an awesome man, a very humble man. He died recently at the age of 94 or 96, and I watched his interviews, which were just awesome. He diagnosed the earliest Kraft patterns, and this was the earliest diagnosis of diabetes. And what he found in the 14,384 people was that more than 3/4 of the people had normal glucose levels, but they failed the Kraft test. They were not okay. They were actually diabetic, as most of us are in the American subcontinent. Why? Because we have been taught to eat the USDA food pyramid. We've been taught to eat low fat and get our calories from carbohydrates and grains and starches and sugars. And that is diabetes city. It's a matter of time before we will get very, very sick. A lot of people who are allergic to grains are actually allergic to the carbohydrates in those grains.
Mm. If you could explain one part of the graph where it says insulin response patterns 2 to 4, I assume that's some degree of the intensity of or the condition, the levels you have.
Yes, yes, yeah. Exactly. So these are the 3/4 of the people. Out of the 14,000 people, like 3,000 or 4,000 had normal insulin levels, and the other 12,000 or thereabouts had high insulin levels. And those were the people who, if they had addressed their diet early on, would not have had these conditions, because we know that in American history, people lived long, healthy lives. Once you got past the infectious diseases, lifespans were big. People ate, they fried things in bacon. They used their tallow. There were no industrial oils. They did not eat. They may have eaten sugar, but they compensated for that with exercise, heavy duty exercise. So the diet we are on does not make sense for our sedentary life habits today.
So you said something about a higher sugar can be not balanced, but ameliorated by activity, physical activity, exercise, and so on. Does that mean that athletes can eat more sugar and then they can burn it off by running or whatever exercise they do?
Yes and no. Yes and no. I know so many athletes who have raging diabetes. They run ultra marathons, they loaded up on pasta, and they bonked, you know, the word bonk, when you hit a few, you know, miles, you suddenly have an energy lag. These are the people who, when they move to a high fat diet to propel their runs, they became non-diabetics. So eventually high amounts of carbohydrates are going to shoot your pancreas down, or make you very, very sensitive, insulin resistant. Not sensitive, insulin resistant.
Great, thank you.
I would very much recommend for people who are doing ultra marathons, wrestlers, bodybuilders, and bodybuilders need insulin because it's an anabolic hormone, right? So it makes muscles. But other than these few very specific sports or activities, I would recommend people try and get their bodies accustomed to eating fats for energy, so that you are able to burn, your brain is able to burn fats for energy. If your brain is not able to burn fats for energies and burns sugar, you get sort of diabetes of the brain, so to speak, and that's Alzheimer's. So if you want to have good cognition, eat butter, folks. I hope everyone's on the butter run.
Yes, yes.
No, what, can I interrupt a second and ask a question about the butter?
Yes.
Is there any way that I wasn't able to order any of the raw butter that you suggested a while back, but is there any way that I can get, say, 5 pounds or so of that butter from someone that has an oversupply?
I have some extra.
Absolutely.
I have some extra.
There you go. Ellen will give you some, Ruth.
Ruth?
Ellen?
Yeah, I'll put my contact information in the chat.
What's your name? Ellen?
Ellen Marie. I will put you two in touch. Ruth, I will put you in touch with Ellen Marie.
I'll put my
I appreciate that. Thank you.
I'll put my contact information in the chat.
In the chat?
Yes.
Okay.
Or I will just introduce you via email. Not to
Okay,
worry.
thank you very much.
Yes, and if anyone else has butter needs, and if someone leaves their butter behind, I will let people know there's more butter to be had. But for now, the official order is closed. All righty.
Can I ask a quick question?
Sure.
What about people who have a real hard time digesting fats or had their gallbladder out? Do you have suggestions for making it easier or possible for them to eat more fats?
Yes, yes. So it's a very tricky, very good question, and a very tricky question. What happened between the 70s, 80s, and 90s was with the low-fat dogma, women who wanted to lose weight went on these horrific low-fat diets. And when you go on a low-fat diet, your gallbladder is extruding bile to digest, to metabolize fats. It kind of gets gummed up there and turns into gallstones. And so this yo-yo dieting in the 70s and 80s led to a lot of gallbladder problems and removals of gallbladder. And so now we have a situation of people without gallbladders who cannot eat fats without a lot of pain. And so what you want to do is you want to do drip, 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 which is your liver. If you're seeing my hand here, your liver is constantly extruding bile through your duodenum into your intestines. And what you want to do is get your liver accustomed to putting the bile directly into your intestines so that it digests the fat as it comes along. If you were low carb, if you were high carb before, and all of a sudden you add a bolus of fat to your diet, you're going to get horrible diarrhea. You're going to get horrible stomach pains. You're going to get horrible intestinal pains. And what you will end up doing is not eat fats. When you don't eat those fats, you're going to get more macular degeneration. You're going to get more diabetes. And it's like a vicious cycle that perpetuates itself. So I would recommend a seesaw. If this is your diet right now, slowly add in fats. Every time you add in fats, take ox bile, sauerkraut, beet kvass, and enzymes with the fat. but do get used to digesting fats slowly, not rapidly. Did that answer your question?
Yes, thank you. I just wonder if you know, do you know if beet kvass is high oxalate? I know beets are, but I don't know if the
It's
product
not.
get into kvass. It's not.
It's pre-fermented, and so I find that people digest it well, but in the early going, you might have trouble. So if beet kvass does not agree, and you will know right away, does not agree with you, by all means, try another ferment. Try another ferment, try enzymes, betaine, HCl, pepsin, and other enzymes, and bile, ox bile capsules. Eat that along with your fat, and you'll be able to digest it. And what will happen is, as you eat more fats, your body will get used to burning fats. And when that happens, you can continue to eat fats all the time without stomach pains. Any other questions?
I have a question about any relationship that fasting may have to ocular health and other health,
Yes.
mostly ocular aspects.
Yes, very good question. And two answers. One is, if you fast enough, your blood sugar levels are going to go down enough, your insulin levels are going to go down enough, your VEG, then vascular endothelial growth factor, is going to go down enough, and you're going to get better. But you want to fast regularly. You want to fast to the point where your insulin levels go all the way down as low as possible, and hold it for a long, long time, because that's when your healing is going to occur. Healing cannot occur in an environment of high insulin levels. When you're fasted, your insulin levels are down, and that's when your healing is going to happen.
Does that also happen with, I can't remember the exact phrase, but mini fasting, where you separate the amount of time you eat from not eating?
Nope. So if you're here and your insulin levels are here after 2 hours, you fasted for 2 hours, and then you start eating again, you're going to be right there all the time. It varies from person to person. In a very hyperinsulinemic person, it's 5, and he didn't measure past that, you know. But if you say have 12 hours or 16 hours of this level, if you're a hyperinsulinemic, that's a good thing. And over time, your insulin levels will drop. They have noticed that in fasted individuals. They become more insulin sensitive, meaning your body is not on constant alert and ready to put out insulin if you fasted long enough. But for every individual, that fasting period is going to vary. So someone like this, who has low insulin levels to begin with, in 6 hours, their insulin levels will be 0. So they can do an overnight fast or even 5-6 hours, and they're fine. But if your insulin levels are inherently higher from just a lifetime of high insulin levels, then you need to do a longer fast.
All right, thank you.
I have a question.
Yeah.
I have a question about fasting as well. What about fasting? I guess you call it intermittent, meaning I usually eat or try and eat by 6, and then I don't eat until 10 or 11, sometimes lunch. Is that considered a long fast?
It all depends on your condition. It depends on your insulin levels. If you're here, that's a very long fast for you. If you're here, that's a short fast for you.
So to find that out, you would have to do the complete test.
Yes, you would want to know whether you're hyperinsulinemic or not. And there are clues, you know, you see blurry, your kidneys hurt, you've had heart disease. So those are all signs that you're doing everything right, and yet something's happening. Go measure your insulin.
Okay. And how about, as far as diet goes, the Ayurvedic way of eating, does that support a diabetic or insulin resistant?
Yes, absolutely, provided you understand the macros, the importance of the macros and the effect of the macros. Remember, Ayurveda is a 5,000-year-old science.
Mm-hmm.
We did not have insulin measuring facilities back then, nor glucose. We divided people up by their Vata, Pitta, and Kapha personalities, and Ayurvedic doctors devised certain types of foods for these people. That having been said, you know, you could have a Pitta, a Kapha person with diabetes, you could have a Vata person with diabetes. So within that narrow range of what foods they eat, they would want to focus on those kinds of macros, whether they're carbohydrates or fats. And I know people who do not thrive unless they eat carbohydrates. There are people who need carbohydrates, more carbohydrates in their diet. And that's your personality type. And for that, you know, just looking at yourself and looking at these numbers in the context of a diet that's Ayurvedic in nature are very good. Things like spices are also
Right.
split by Ayurvedic type. Absolutely.
Thank you.
Any other questions?
Sushama,
Yep.
Margaret, going back to macular degeneration, I'm concerned, will my diet help me from it becoming a wet macula, which is something I dread? Because then the only help is eye injections, and I don't want to do that.
Yes, yes,
So
absolutely. Yeah.
Specifically, what can I do?
Specifically, what you can do is get the energy into your eye from fats, fats rather than carbohydrates. When that happens, you're not going to stroke out your arteries and veins. You're not going to have ischemia. You're not going to have retinopathy, and just be nourished. Eat lots of vitamin A, which means liking liver, my darling. Do you like liver?
I'm trying, yeah.
Okay, just.
And I'm taking cod liver oil
Awesome.
every morning, yeah.
Lots of vitamin A for the rods and cones, a low carbohydrate diet, rich in fats. You want rich fat diet, and you will definitely stop the progression, if not start to heal it.
Yes, I feel that I have to a point because of all the good fats I'm eating. So I'm encouraged, but yes. I'm just hoping that it doesn't become wet.
Oh, absolutely. And I would say you make ghee, right? Whatever ghee you were eating, eat 2 to 3 times that ghee on your vegetables, on your
yes, all the time.
Yeah, and that'll make a huge difference.
Thanks, Sushama.
I have a question that I think I know the answer to, but I think I'll ask it anyway. I'm going to visit a Western practitioner, an ophthalmologist, whose experience I respect in certain areas, but I'm going to see him on Tuesday. Are there questions that I can ask him that can add to my knowledge of what my condition is or what I need to do from his perspective?
Yes. So what you want to know from him is, what kind of cataracts do you have? Are they cortical? Are they nuclear? Are they subcapsular? Where did they emanate from? What does he think the source of those cataracts, or the reason, cause for that? He's going to say no cause or age related, but you can poke him more. You want to understand what your ocular pressure is, exactly what it is. You can ask him what the health of your optic nerve is like. So there's a lot of questions you can ask him. You could ask him about your processes, ciliary processes, trabecular mesh. I mean, he can measure a lot of things that you should get pictures of and understanding of, so that you can bring it to yourself and say, okay, this happened when I injured my eye, or this happened when I was on this diet. But you need the measurements. You see, what we're doing in this natural health study group is we're measuring objectively and then applying natural principles. But you need to have those precise scientific measurements.
Got it. Thank you very much.
I will add one more proviso, without injecting dye into your eye or doing things that actually harm your eye.
Right. Which could include things like laser treatment, which I did endure one time.
Yes. Yes. Sadly, yes. But understand that if you have a cataract, there's surgeries, and you can put in a spanking new lens, which has all your prescription even, and we've had very good results. And it's a piece of cake for a lot of people. But you don't want to go there as much as possible. You want to avoid complications.
Right. Thank you.
One more question? No question. Okay. All righty. We were at Viagra. I think I repeated some of these. I'm sorry. This last section should have been taken off.
Could I just ask?
Sure. Cornwall. Yes.
Yes, Cornwall. The insulin test,
Mhm.
I thought you said that doctors don't like to do it because it is rather expensive.
Yes.
What is it just called an insulin test? What is it called if you wanted to have?
Yeah, just say blood insulin. You can cajole your doctor to do a random blood insulin test. Then you can do a postprandial. So start with those two, and then walk him through the research and say, hey, doctor, I want to do a 5-hour test. If you suspect you have diabetes or pre-diabetes or such problem, if you don't have a problem, you don't have to do anything.
Yeah, I don't think I do, but I was just curious. Oh,
Yeah.
well, thank you very much.
Yeah. And I think you can talk your national healthcare doctor into one test, one shot, random insulin, pre-prandial, post-prandial. But I think it'll be difficult for you to talk them into the every hour test.
Yes, I know that you are restricted. I mean, thank goodness for the NHS, but it does restrict your choices.
Yes, yes, yes. But you can try. I mean, if you have a
Or you have to go privately.
Exactly, yeah. And it's not terribly expensive. It's like a few $100, not too bad. Yeah.
All right, thank you.
I have one more question.
Sure.
Since my whole family has this glaucoma issue in all levels of severity, my youngest sister goes regularly for shots in her eyes, and and she has headaches and really suffering.
Yes.
She lives on the East Coast, so I only know this by talking to her, and I see her once a year, but how can I share this information with my family for their knowledge? Is there a book or two, or how would you share it?
Yes, Joseph Kraft has written a wonderful book on this. You can share that book. I'm going to be recording this. You can share the video. What else? There are lots of very good research papers by various doctors from the 60s and on insulin resistance and low carbohydrate diet. Read the work of Dr. Stephen Phinney, Phinney, and Volek and Phinney on a lot of these issues. Very good science, very good.
Would you spell Stephen's last name again, please?
Phinney, Steve Phinney, and Volek, Volek.
Thank you.
Thank you.
To the person, was that Lorianne that asked that question?
Yes.
Yes, so I will add one more comment to it, and that is we all love our family members very much. And there are things we can talk about to them. They are gonna listen part of the time. The best way I found to help them get to a better place is do it in small bits, bits. Ask them to take one small action, such as cut out the donut in the morning or whatever it is, and just say, hey, eat butter and not the bagel or something like that. And it is with these small steps that they will feel better enough to take the next step. If you overburden them with the science, I mean, you guys are a little bit masochistic, but everyone, the regular folks in the world will welcome one small change. And then you go from there and say, hey, the reason I'm saying this is the following.
Right.
Oh, you tell me what works for you guys to talk to your friends and relatives. Sunshine, unmute.
Okay. Well, I was just thinking that I've told several people, they say, oh no, I can't, butter, no. And I say, have you ever tried putting it in your herbal tea? And they say, ooh, that sounds terrible. But I said, well, at least do it for 1 or 2 days and see what happens. And they love it.
Wow.
They love putting, and it's a wonderful way to get a couple tablespoons in each day early on. Yeah.
Perfect.
Yeah.
Thank you. I have spoken to my sister. She has an incredibly stressful job. So I've encouraged her to, you know, try ways to de-stress, because I think stress causes
Yep.
more disease than
Anything else?
anything else. And so I suggested yoga. This was when I was doing yoga too. She goes, oh, I can't do yoga because I have glaucoma.
Mhm.
So do you? And I also, before I was just diagnosed, I think my doctor missed it for years. Now I did a whole yoga teacher training and then found out, you know, I have glaucoma, and I'm wondering if it elevated. I did a month intensive, maybe it elevated my pressure or something, but
Nope.
all of a sudden I lost my whole love of, I mean, didn't lose it because I love yoga, but I'm afraid to do it. So here I am trying to encourage my sister to do something like that. And then I learned that you're not supposed to be doing yoga, or at least that's what my eye doctor said. And I said, well, are there studies on doing yoga and glaucoma? And she goes, I don't know, but I wouldn't do any downward dog. Well, it's hard to do yoga without being upside down. It feels so good.
Yes. So I have some thoughts on that. That is the biggest piece of bunk on earth. Yoga will heal your eye. Yoga will not cause glaucoma. What will cause glaucoma is a high carbohydrate diet, injury, accident, ionizing radiation, contraceptives, drugs, antibiotics, antidepressants.
So going upside down will not affect the glaucoma I have, or pressure.
No.
That's so funny. My doctor was so serious. She goes, well, if I were you, I wouldn't be practicing.
I have never heard that, but that's a first. I've never heard that one before.
Get a new doctor.
Get it, exactly. Find yourself a new ophthalmologist, please.
I have a kind of a personal thing about doctors looking serious. Years ago, before I even knew what I was doing to some degree, my doctor looked at me quite seriously and said, your cholesterol is too low. I'm going to prescribe some statins for you. And so I started taking statins for a fairly short time. And then I went in and tested, and he said, look, your cholesterol level has gone down. How wonderful. And he had this glee on his face. And I realized how immersed I was in his reactions to what my body was going through, rather than paying attention to my body.
Hallelujah.
Big change for me.
Yeah. What was your body reacting like to the statins?
I don't think there was any reaction. None that I'm aware of. I knew that the level went down to something from 240 or something down to 190, something, who knows what. Something like that, which he considered a success. He actually, by the way, died a lot earlier than I did. He died of cancer.
Yes.
So
yeah,
it was not his body that gave the biggest reaction. It was his ex-wife, me. I told him he was crazy for being on statins, and he got off of them.
Awesome.
And that's when I started really investigating what statins are all about and cholesterol is all about. And as my want is, I read and learned a lot about it. But thank you to my ex-wife for that inspiration.
Good for that.
I'm also going to put a plug in for the parasympathetic.
Yes.
You know, I usually mention it each time. And, you know, for the person who says her sister is in a very stressful job and everything, do some investigation about the autonomic nervous system and the parasympathetic and the sympathetic systems, because basically I feel that's been what's been saving my life with all the fears that everyone has around me with this pandemic and, you know, losing businesses and losing work and et cetera, et cetera. staying as much as I can in the parasympathetic has made a huge, huge difference in my life.
So true.
So, yeah, so because, you know, I love saying this, worry is a negative prayer. What you worry about, you're praying for, but it's a negative prayer. Yeah.
Absolutely.
That's all I have to say.
Well
Stay
said.
parasympathetic.
Well
Thank-
put. Anyone
Thank
else
you.
have anything else to say?
I express my thanks to you, Sushama, for your particular dharma or work or devotion or whatever you call it or however you view it. I benefit from it as well as from a lot of the things that everybody says in the group. So thank you to all.
Thank you. Thank you.
Know
guys.
that.
Thank
Thank
you.
you.
Yes, thank you.
All righty.
Is
I
All
second
right.
that.
One more thing.
Yeah.
One more thing. Can any of you see what I brought into my apartment or who I brought into my apartment? Because I've not allowed anyone into my apartment in this whole time of pandemic.
Mhm.
Can you see behind me who's here?
No.
No,
Oh, too bad. Let me see. Hold on. Let's see. Can you see her now? I brought in a mannequin. I brought in a
mannequin.
mannequin
Scarf and a hat.
and I dressed her up. And you know, it's just like my worry dolls. I can tell her my problems and she can deal with them. I don't have
There
to.
you go. Everyone needs a worry doll. Yes. Put it
Yes.
out on her. All right. So back to insulin resistance. The things that you notice: psoriasis, weight gain, gastroparesis, which is you don't have a bowel movement, and then 10 hours later, suddenly your sphincter is loosened. That's from diabetic neuropathies. Glycosylation of the retinal nerves, arteries, veins, cataracts, macular degeneration. All of these are related to insulin resistance in our current way of eating and thinking. Carpal tunnel syndrome, frozen shoulder, hypothyroidism. And so you will gain greatly by increasing the good fats in your diet. And I will get to the good fats, but let me finish this first. The muscles in your eye, the levator palpebrae muscles, narrow your palpebral fissure, and you find that in diabetics, the eyelids kind of droop, so you can't see as well. And this is neuropathy in the third cranial nerve. Retinopathy is leaky blood vessels in the eye, which is, you know, it could happen in your macula, it could happen on your retina. That's just a name, but the fundamental problem is leaky blood vessels. Eye strokes, macular degeneration, pressure in your eyes, in your aqueous or vitreous humor. And then the cataracts, where the proteins precipitate out, sugar oxidizes out, and it kind of gums up your lens. So
could
these
you
are all-
say, I'm sorry, could you explain just a bit more what glycosylation means?
Yeah, glycosylation means when you fry your onions with a little bit of ghee, the sugar in the onions caramelizes. That's glycosylation. It's oxidation of the sugar in your bloodstream. It's insulin causing hardening of your arteries due to oxidative damage. And so it's a sort of a knife that goes through your system that your body can't stand. And that's oxidation. And proteins get glycosylated by sugars as well. So the proteins caramelize. If you have joint pain, that's glycosylation in your joint, sugar in your joint. When you take it away, your arthritis goes away.
Okay, thank you.
These are all problems of the same fundamental underlying cause. And now for homeopathy, my favorite topic. And I'm gonna go a little bit fast through this, and you can review it later, and we can do another sort of study group on homeopathy alone. But hyoscyamine is a remedy that's used for scarred tissue. So if you have injury, if you've got scars in your eyes, if you have hard deposits in your cornea, Calcarea florica is a very good thing. If you have red eyes frequently, eye strokes, or congestion in your eyes, try arnica. If you have dry burning eyes, try euphrasia. And start in small potencies, 6C or thereabouts. But look at your eyes, look at your conditions, look at this PowerPoint and figure out what you need. If you have strabismus, which is one eye is moved there and one eye is moved there, posticum is a great remedy, especially for left eye strabismus, where the left eye is still and cannot move in conjunction with the right eye. If you have eye strain from looking at computer terminals and so on, Ruta Grav 6C or thereabouts is a great remedy. If you see floaters, there's various remedies that, based upon your individual symptoms, are the right remedies for you. But I have put in a list of remedies. Chelidonium, which is liver. So the person who said they have liver issues, Chelidonium majus 6X or small potency, Nat Mur, Natrum muriaticum, will address dry, wet issues. Phosphorus is very good for if you're bleeding from your eye. Physostigma is wonderful for eye injuries and floaters from eye injuries. Sepia if your eyes are feeling very weak. Silicea if you have things embedded in your eye or if you have hard deposits that you need to get out. So these are some remedies that you want to take in small potencies based upon your needs. This is for Fuchs Dystrophy, which is a corneal damage of the corneal membrane. And what happens is you either have dry eye or your eyes get agglutinated together. So you have a very thick eye goop coming out, or it's so thin that you get dry eye. And so if it's dryness due to lack of the aqueous humor, you use alumina. Arsenicum album is for dryness due to inflammation. Apis if you have redness, edema, and allergies. For folks who are new to homeopathy, this is gonna be a little bit too much. And I ask for your patience and forbearance. But if you listen to this or watch it enough, you'll get a good hang of it. Calphos for foreign body, a sensation of grit in your eyes is calphos. Oh, sorry, Staphylos aureus. Calphos is very good as well. If you have dryness and redness of the lid and allergies, sulfur is a great remedy, small potency. Corneal health, you know, if you have abrasions and so on, calendula is a great remedy. And likewise, if you have thick discharges that gum up your eyes at night, as many women in particular tend to have, try alumina, small potency, try arsenicum for inflammation, Apis, euphrasia, calphos, Staphylos aureus, sulfur, based upon the kind of symptoms you have. Cataracts that develop post-surgery. People got surgery, something got damaged, it was partial surgery, and you know they can't see well because they have cataracts. Senega is a wonderful remedy of post-operative cataract, or if they got a partial cataract surgery, you know, and there's pieces in there, Senega is a great remedy for that. Arnica to mop up any blood clots, hematoma, underneath, venous blood congestion and so on. Strontium carbonicum is a great remedy. If you got hit in the eye, then calendula, conium, and tellurium are great remedies. If you have developing cataracts, then Antart, Antimonium tartaricum, pulsatilla in China are excellent remedies. If you're over 70, 80, calfluor, carboanimalis, and conium are great remedies for hardened cataracts. If you have cataracts with photophobia, nat sulf or serenum are very good remedies. If you have diminished vision, then silicea, magcarb, and ammoniacum durima are good remedies. If you have opaque spots in your cornea, not in your lens, but in your cornea, then calfluor is an excellent remedy. If you have senile, traumatic cataracts and corneal opacities, there's this thing, and this is a thing that's found in India, Cineraria maritima. It's a great lymphagogue, and it helps to dissolve cataracts, and it's applied topically. So you take the tincture and apply a couple of drops topically in your eye. Good results.
Would you repeat that, please, or point to which item you're talking about?
Yes, so let me take my cursor, and that's it. Senile cataracts and corneal opacities, Cineraria maritima. Especially things that are close to the surface of your eye, the tincture will act upon it, and it helps the lymph and the aqueous humor to flow better. And
Thank
these
you.
are powerful, powerful remedies. The question you always have to answer is which of these is the right one for you. Incipient cataracts. So like if you have cataracts that are growing, you're light sensitive, it bothers you at night, Natmur is an excellent remedy that helps with the flow of fluids in and out of your eye as well. Then there's the Banerjee protocol, which many people have had good success with, especially if they have incipient cataracts, eye problems. Calcarb 200, you mix it with belladonna 3C and take it daily for several months.
On several of these, you don't have the dosage except for the 3C for the Banerjee protocol. Is it starting small and then going larger if needed?
Start small if you want to do it routinely and regularly. Go bigger if you're very certain that the remedy is the right one, and also if you have a bigger problem. On the other hand, if you have a big problem, it'll frequently get aggravated by high potency remedies. So I would say, go with the 6 or 12 and do it thrice a day, 4 times a day, or, more frequently, smaller potencies. And as you get better, you will learn to use larger potencies for things that are dead ringers and that have an effect on you.
Got it.
So I know it's not a full answer, but it's the way to an answer.
Yes, I appreciate that.
All righty. The next is glaucoma. Phosphorus is a great remedy for glaucoma with optic nerve damage and bleeding. So I would recommend that for you, Margaret. Optic nerve damage, bleeding in the eye. Como Claudia is a great remedy for a sensation of fullness where you feel like your eyeball is popping out. There's so much pressure. That's Como Claudia. Belladonna, if you get injured or you have a closed angle glaucoma, which is from a sudden emergency where the angle closes. And yeah, Richard's telling me it's almost time. Yes, it's almost time. I'm almost done. Can everybody wait another 15 minutes?
Sure.
Okay. Physostigma is for glaucoma following injury. Prunus spinosa for sudden pain in your right eye. Cedron for pain in the left eye. And this happens when you have closed angle glaucoma, not open angle. If you have sudden injury, right eye, left eye, spigelia is a great remedy also. So take a look at these. I would invite you to read the Materia Medica on these and see if they apply to you and use them. They can't hurt you. They're not going to hurt you like steroids, eye drops, antibiotics, prednisone, and other drugs. These are this is very gentle medicine. If you have retinal atrophy, carbonium sulfuratum is great. It's actually, I misspelled it, maritima, cinerea maritima, Heliaitis, leucocephalus, kalium chloricum, phosphorus, and phosphorus is generally available. It's great for retinal atrophy. If you have choroid, there's another layer in your eye, in the back of your eye, choroid. If that is atrophy, the cinerea maritima is great. Kalium chloricum is great. Kali iodatum is great. So if there's atrophy, swelling, kali iode is a great remedy. And to strengthen your eyes, I would recommend tissue salts. These are 6x to 8x to 12x. I think you can find them in Good Earth, but definitely in Rainbow Groceries. Calfluor for strengthening your tissue, to build your cells up. Calphos 6x. Nerve nutrient for your optic nerve, Caliphos 6x. Take them frequently. Fluid distributor, if you have dry eyes, wet eyes, Natmur 6x is great for too much moisture, too little moisture, especially wet macular degeneration. Natrum muriaticum.
Palming gas.
Land?
Yes. I have a brief question. I don't know if you'll cover it. We can do it privately, but I've done some, I call it independent research on my cataracts and found 2 items that are recommended for treatment. One is castor oil, and the other is sap from the pine tree, which is turpentine. I'm wondering, as they're externally applied, and I wonder if you have any experience or know anything about their use.
Castor oil is going to act like other emollients on your eye, especially if you put it on your eyelids. A better recommendation is to ingest the fats internally, which is to eat a high saturated fat diet. When you do that, dry eyes literally disappear. High cholesterol, high fat diet. Turpentine, I don't know anything about.
Okay. What I read about castor oil was direct application to the open eye can help in alleviating or reducing the size of a cataract.
It may very well. Castor oil is a very healing and tumor reducing agent. I would try and apply food as a remedy from the inside and out so that your body figures it out. But I see
Understood, yeah.
nothing wrong with applying castor oil on your eyelids on top. It will absorb through.
Okay, thank you.
Eye exercises, I would urge everybody to hold their eyes, turn their eyes round, up, down, diagonally, circling, just to exercise your eyes, gently press your eyes, you know, to rest them, especially when you're in front of a computer terminal. We are like this on a computer terminal, and that's not good for the eyes. Look cross-eyed, look sideways, so good eye exercises. Everybody should do zooming. So if you're looking at a screen for, 5 minutes, spend another minute or two looking out at the far horizon from your window, and that'll help you not strain your eye too much.
I have something to add to this from personal experience. Years ago, I was painting murals in the city in San Francisco. And at the end of the day, I could hardly see very much because I was working at a constant distance. And then I read about the Tibetan Thangka painters, the ones who work on that. And they would do exactly what you pointed out. They would work very, very closely, but every 15 minutes, 20 minutes or so, they would look away, look at nature, look around. So, and then they go back to their work.
Very excellent.
And they claim they had perfect eyesight.
Yeah. And you can't ignore that. You cannot ignore this basic tenet of health. You cannot sit and do embroidery for hours on end without looking up or look at a screen, without destroying your eyes.
Yeah.
Very good suggestion. All righty, I get to my favorite part. Eat raw butter, raw cream, cold pressed oils, tallow, lard, beef from pastured animals. Remember that fertilizers, pesticides, poisons, mercury, aluminum concentrate in fat. And so you want fat from pure sources, and you want it to be a big part of your diet. Big part of your diet. What you want to avoid is the longer lasting, extended shelf life vegetable oils, any polyunsaturated fats that are made in a factory. They will cause cataracts. This is one of the biggest causes of ill health. Cataracts, glaucoma, macular degeneration, cancer, heart disease, wrinkles, premature aging, immune system dysfunction. It disrupts your prostaglandin production. So it really, really affects how the tonic, the osmotic pressure in your eyes is regulated, depresses your liver, depresses your ability to learn, damages your reproductive organs. So if there's one thing you could all do, it is to go to your pantries and throw out any oil that's liquid. Even olive oil, I would say 80% of it is adulterated. Please use saturated fats for cooking and eating. You will see instantaneous results in your eye dryness, in your eye health, in how your skin feels, in how your liver operates, so on and so forth. If there's one big cause of chronic disease in today's world, it is the bad industrial oils we're using, the cheap shortcut oils. You want to eat stuff that you get from your farmers. We have, by the way, we're doing almost 7,000 pounds of butter and cheese this year worth $45,000. So you guys have figured out what is good food. Add liver for good eye health. Please learn to love liver, whether it's pate, whether it's cooked liver, whether it's raw liver blended with butter and mushrooms and onions. Pick however you want to eat the liver. but please add liver to your diet. 100 grams of liver contains 53,000 international units of vitamin A. It contains B6 and B12, massive amounts of B12. Nothing comes close to liver, nothing. If you want good eye health, eat liver thrice a week. Liver is super cheap, guys. Nobody wants liver. People hate liver. It's what is other people's poison can be your gold.
Any thoughts, recommendations about liver from different animals?
Sure, liver from any animals you can fight, so long as you know the difference between good liver and bad liver. People said, how do I know this is, if it's a good, well-raised animal, the liver is gonna look beautiful. If it's a bad animal, it's gonna look brassy, yellow, turbid color on top. You will know good liver when you see it. Buy fresh liver whenever possible. And just cook it. Just throw it into your burgers and in your soups and stews. Your family's not gonna know, just hide it.
How about liver sausage? Liver sausage?
Liver sausage, awesome. That's the perfect way to get liver in. Eat liverwurst.
Liverwurst, yeah.
Great, okay.
All righty. Vitamins, so all the foods that I just mentioned, the raw fats, the cream, the liver, will cause you to eat fewer carbohydrates. You won't have this huge insatiable appetite for, low fat, high carb items. They contain very high amounts of fat soluble vitamins, which are needed in great quantities for ocular health. Vitamin C is present in leafy greens that are slathered in fat and lightly cooked and eaten. Liver has vitamin B's, which are very critical to your eye health. I thought I would motivate you from the experience of a person I know in one of my Facebook groups. Actually, she gave me permission to post this. They put their grandma, who was eating pizza every day, on a higher fat and lower carbohydrate diet. And this is what Rachel Berg said. My grandma is 89, keto, has black hairs growing in. You can see that, right? Gray hair, black hair. Darker than she ever was before she started to go gray-white decades ago. No events in her pacemaker, no longer pre-diabetic, labs are fantastic, blood clots gone. She's off a ton of meds and much, much more. She has lost 38 pounds. Her petechiae is when you start bleeding from various orifices, not orifices, but your capillaries, which means she was bleeding in her eyes. She was bleeding from her retina. They're all gone. She's down 2 shirt sizes. Her hair is twice as black and thick. Her face spot has lightened. There's a big black spot here. It's lightened. Her acid reflux is gone. Her edema is gone. Spine pain is gone. That was from botched surgery. Her brain fog is lifting. Her chronic bronchitis is gone. Her allergies are gone. Strength and energy is increasing. Sleep improved. Her funny sense of humor has come back. You get crabby when you don't feel well. If you want your sense of humor back, eat butter, guys, or ghee. Her heart function is back up to 65%. Blood work is amazing. Clot post-surgery is gone. She's off trimethoprim, pantoprazole, that's GERD medicine, gabapentin. Blood pressure perfect, prediabetes gone. She's on 1 avocado per day for potassium. And this is just a sort of list of the kinds of things you can eat. Rather than focusing on what you cannot eat, this is a list of the things you can eat. So stare at it as you go along, put it on your refrigerator. All vegetables are good, eggs, meat, offal, in particular organ meat, seafood, dairy that is whole dairy, not low-fat dairy. Fats and oils that are cold pressed being the key word, and saturated as much as possible.
What are trotters?
Oh, trotters are the feet of pigs.
Okay.
Very rich in glycine, very rich in the amino acid glycine, gelatinous, very good for all epithelial health. Nuts and seeds, beverages that are pure tea, coffee, flavorings that are spices. And if you need visual aids, there's a couple of very good visual aids. There's a dome magnifier that illuminates things, 5-6 fold. Ralph, you probably know about it. You can speak more to this than I can. Then there's this Optelec CCTV type television camera. It's a great, great invention. I think it costs a lot of money, like $1,000 bucks.
Oh, more than that, 5,000.
What?
Yeah, it reads back to you also.
Goodness.
Oh, it reads back. That's
Yeah.
Got your stories too, or whatever.
No, you put your sheet of item to be read under the lens, and it magnifies it and also reads it to you.
Goodness.
wow, wow. So there you go. Ralph, any other visual aids that you can think of?
Well, I have my magnifier, but the stronger it gets, the smaller area you cover. So,
Right.
yeah, I'm at a four time magnification now, and I can't go beyond that because it's too awkward. So what I've done is I've increased the size of my type on my iPad and also made it bold, so that makes it easier for me to see it. But I still depend on my magnifier for that. And then there's an app called VoiceOver. So you could have things read to you on your iPhone or iPad.
Wow, wow.
Yeah.
All right, all right. Excellent. Any other questions before we wrap up? People are probably tired now.
Yes.
Okay, thank you so much, guys. I'm gonna stop sharing and stop recording.
May I
Thank you.
just ask one question? If-
Sure.
How do you, wait, I was rushing to get this in. What about hydration?
Hydration, yes, good question. Hydration to thirst. For people who drink way too much water, you're basically denuding your body of minerals and causing great danger to yourself. So anyone who tells you to drink 8 bottles of water, read the book Waterlogged by Professor Tim Noakes. Drink to thirst, and what will cause hydration in your body is fats. 1 molecule of fat metabolizes to 10 molecules of water. So eat more fats for hydration.
Putting salt in it so that yeah?
You could, but you're still gonna, the more water you drink, the more you're gonna pee out. And then it becomes like a perpetuating cycle. And especially diabetics get very thirsty. But if you eat more fats, you're gonna feel less thirsty.
Great, thank you.
What's the author of that book?
Tim Noakes, Professor Tim Noakes. It's called Waterlogged. It speaks about
what?
Noakes, Noakes.
NOLKS.
Noakes.
Okay.
No, that's.
All right. Thank you, everybody.
Thank you.
Thank you so